Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. We are comparing the Rotor syndrome with the Dubin Johnson syndrome. So let's begin with the Rotor syndrome. The Rotor syndrome, as there is a letter R, it is autosomal recessive. And what will be the defect here? The defect is in the organic anion transport polypeptide defect. So it is organic anion transporting. So organic anion transporting polypeptide defect. So this includes the OATP 1B1 as well as the OATP P1 B3. Now when you look at kernicterus will be absent here. And then what about the biopsy? Biopsy will be normal and the total urine coporphyrin, this is going to be elevated, and the urinary coporphyrin 1, this is going to be less than 70%. Then the brome sulfalene clearance test. So there is brome sulfalene clearance test. This is going to be, it shows a slower clearance, that is slow clearance. Then what about the gallbladder? The gallbladder on the oral cholangiography. So gallbladder on the oral cholangiography, it is visualized. Next is a question on the cholestasis. So when you look at the cholestasis, it is, answer is no. Then the serum bile acids, this will be normal. Then comes the presence of jaundice. The jaundice will be mild. Mild in the sense the TB will be less than 4 mg per dl. Now the same way, let's look at the Dubin Johnson syndrome. So in terms of the Dubin Johnson syndrome, it is inheritance being autosomal recessive. And what will be the defect on? The defect is on the multi-drug resistance and multi-drug resistance protein. So it is known as the MRP. The MRP2 mutation. And what about kernicterus? Kernicterus is absent, just like the Rotor syndrome. Then looking at the biopsy, in Rotor syndrome it was normal, here it is going to be black pigmentation. Then what about the total urinary coporphyrin? Total urine coporphyrin, it is going to be normal. In Rotor syndrome, with the urine coporphyrin, it was increased, here it is normal. And looking at the urinary coporphyrin. So in terms of urinary coporphyrin, porphyrin 1. So here it is greater than 80%. Next is the brome sulfalene clearance test. So in terms of brome sulfalene clearance test, so here there is, in terms of rotors, it was slow clearance, here it is no or delayed clearance. So it is delayed clearance. Then when you look at the gallbladder, so gallbladder, and this is upon the cholangiography. So gallbladder upon cholangiography, it is not visualized. Whereas in rotors, it was visualized, here it is not visualized. Then cholestasis is going to be, the answer is no. What about serum bile acids? So serum bile acid is going to be normal, and talking about jaundice, it will be mild. By mild, it is similar to that Rotors, that is TB less than 4 mg per dl. To learn and grow daily like this, please do subscribe.